All right. Welcome, everybody. Thanks for being here today with the HUWE1 community. We want to first get started with our Rare X launch with a word from Dr. B. Dr. B, go ahead and take it away.
Oh, hi there. I'm so sorry that I'm audio only and that I can't stay for the whole thing. But for those of you who I haven't had the chance to meet yet, I'm Kristen Bargnano. I'm a child neurologist and neurogeneticist in Baltimore, Maryland. And I've had the privilege of meeting a number of the families affected by HUWE1, and I'm the doctor for some of your kids. Also happy to be a part of the advisory board for Louie's Huwe. So I'm so glad that you guys are here today to hear about this initiative in developing a registry for HUWE1. I cannot overemphasize the importance of this in terms of this being the next step in us learning more about HUWE1. It's going to lead directly to more research and is going to be key to developing therapies and treatments for our kids with HUWE1. So again, thank you for coming today, and I hope you guys will give some very strong consideration to participating in the registry.
All right, thanks, Dr. B. And I want to thank everyone again for coming here and joining us today. Today is a pivotal day in the HUWE1 community. We will be starting our first global data collection program, thanks to Rare X. Because many of us know what it's like to go to the doctor and have them not know what HUWE1 is or how it will affect yourself or your child. Being so rare, we have hit so many roadblocks to information, but we hope that changes today. With Rare X, we hope to gather that information with your help and get it to researchers, scientists, and doctors who can use and collaborate to give us answers and questions about the disease and a better life for those affected within our community. So please welcome Tom Hume, the head of marketing and communication, and Megan, the patient engagement leader, who will help us fully understand and embrace Rare X and help us know what it means to be counted.
Great. Well, thank you so much. And so impressed that you guys have jumped into data collection and really at a pretty early stage. A lot of groups will spend many, many years before they realize the value of their own data for researchers. So really quick, my name's Tom Hume, and I work with Rare X in marketing. But when I'm not wearing my marketing hat with Rare X, I am a parent of a rare child. In my case, my son Parker has juvenile dermatomyositis. It's in the autoimmune space. It's probably about 2 to 3 kids in a million. So it's definitely in that rare area. Really quick, I'm going to have Megan introduce herself, and then I'll jump back in.
Good morning, everybody. It's just been such a pleasure to work with your organization, and to echo Tom, it's amazing that a disease community as young as yours is so forward-thinking about collecting data so they can move research faster and get to treatments faster. So you all should be really excited about this opportunity. I am also the parent of an adult with a rare disease, Phelan-McDermid syndrome. It's a neurodevelopmental disorder, and I helped collect data for my daughter's syndrome for about 10 years. And a lot of what Rare X is doing is to correct the mistakes that groups like ours made when we were trying to do it without much guidance. So I'm really excited that you all will be collecting data and doing it right and getting it out the door to lots and lots of researchers around the world. And I'll let Tom give you some tips about what's going on.
So I'm going to share screen. Can everybody see that okay? Nods? Okay, great. Here we go. Full screen. There we go. All right, so this won't take too long. And please, if you have questions along the way, either put them in chat, or pretty small group, you could probably just raise your hand, or you could probably just jump in and ask. I'm just going to go through really quickly a little bit about Rare X, what Rare X is, and just talk to you about the benefits of data collection, which again, your leadership already realizes. And then really just give you some tips on how to get started in the data collection program itself. It's actually quite simple. You know, I'm going to go through a lot of screen grabs and a lot of images of how to log in and things like that. You'll find it goes a lot faster than what I'm going through, but we just want to make sure you're a little bit familiar. So when you first start to log in and first start to add your data, that things are familiar and the process goes easy. So what is RareX? So RareX is a nonprofit. So and we're created to accelerate rare disease research and treatments and cures. And we do this really by removing all barriers for data collection, which is and sharing that data. So RareX itself is basically a platform that's enabling your community to gather their data and connect it to the right people and to share it widely to researchers anywhere in the world. What's very important is RareX does not own or sell any of the data. Basically, you own it. You set the terms by doing a consent survey and a sharing survey. You determine who should be able to see your data. Now, every time I refer to data in this presentation, it's always de-identified data, which means that it doesn't have the name of the patient or any ways to connect with them, email or anything like that. But the value of this is when you put all this aggregate data together, suddenly rare disease, which has very small numbers, and it's hard for researchers to come to real conclusions with tiny numbers of data. They have enough data because anyone in your community around the world can join this. Now, RareX is not a replacement for any current research that you might be participating in or any clinician-sponsored patient research. Over time, it might help validate some of that research that you might already be doing. So why did your organization decide to do this? Well, one, it's a global data collection. So as I said before, it's not just US-based. Anybody, at least at this time, who speaks English, we're doing translations, but can connect onto this and start adding their data to this. Again, it's patient-owned and managed, the organization. So again, RareX doesn't own the data. Even the nonprofit does not own the data. Benefit is there's no cost, obviously, to you to participate because we're asking you to give up your time and give up your data so it can be helpful to researchers. There's also no cost to researchers. There's a whole back-end cloud platform where researchers can come in and look at this data. What's really very important is that we make sure that the data is structured and standardized. And Megan spoke a little bit about her organization and how they'd spent 10 years, thinking they were collecting the right data. And then when they took it to researchers or possibly the FDA, because everything we do is very FDA certifiable, they basically said, no, we can't use this data. It's not collected in a standardized way. The other thing about RareX is we handle all the governance, all the technology, all the privacy, all the security that's needed to handle what is sensitive information. As I mentioned, it's all de-identified, but in the end, it all speeds up drug development and research. And then, so what are the benefits for you, the individual, not just the organization? Well, what we will do is we will return summary data back to your leadership in the organization. So that could be, you'll see it when you get into it, but we could start talking about what percentage of your community has visual impairment, or what percentage of your community could have seizures, or so we'll start taking some aggregate data and providing that back. And that's kind of a nice benchmark where you can see where your patient might be on the spectrum against everybody else. And again, we do this not just for your community, but we do it for many rare disease communities. At this time, there's over 41 rare disease communities rare diseases that are on the platform. That actually is represented by over 70 patient advocacy groups like yours, and more are coming on every month. So we look at data across all rare diseases, and we do this also by looking at all systems of the body. So you might find, just rather than going to Facebook conversations and anecdotally determining, oh, there's been an issue with growth or development. Oh, I have that too. Oh, we actually have the data to prove it because people will be putting their data in, and things that might not seem to be related are often are, and for other systems of the body that will be shown. We offer a chance for you to participate in clinical trials. There's a question that asks if you are open to that. If a researcher comes along and says, yes, I'm working for some treatments for these particular systems, this group of patients who are in the RareX database or your database would be ideal for a clinical trial, then we play the intermediary and give you the option to connect and participate in those clinical trials. The other nice thing about for you is we try to make it simple. You can update your symptoms at any time. So this becomes is more of a what's called a natural history study, which is basically over time, how are symptoms or how is that journey with the rare disease going? Because it will change and changes over time. And as I mentioned before, this is the way to get your data to researchers. It could be a citizen scientist in India. It could be a geneticist in the UK. It could be anywhere in the world. Researchers would be able to start accessing this data, which is nice because a researcher may not even be aware of your particular rare disease yet, but they might be pulling data that has the symptoms within your disease and then become aware of it. So at a high level, this is kind of how it works. It's kind of a little bit complicated, but basically you have your community, and your community will create what's called a community page, which is basically a front door that goes into the data collection platform. Once you hit get started on that page, you'll go into the data collection platform itself. You'll fill out a consent survey, data sharing survey. You'll provide general info, which is kind of just demographics. And then the very first survey you'll want to do is health and development, because that's sort of the head to toe, and that will feed, depending on what you answer yes to, the other surveys you will see that are more specific. And then on the back end of all this, researchers, as I mentioned, anywhere in the world, they could be with a pharmaceutical company, they could be with an academic institution. They all could have access to this aggregated data. So really what it changes is the model of how research has been, or data has been provided to researchers in the past. On the left-hand side, you can see that a patient advocacy group like yours would usually find one or two researchers who might be interested in this particular rare disease. But on the right-hand side, this is kind of more the RareX model. You're just putting in your data, and then researchers can come and grab that aggregated data, or search it at least for things that they might be looking for and developing treatments for. So it just makes the net a lot wider for getting researchers interested in your disease. Okay, so what do you need to get started? Well, it's super simple. You need an email address, and then you'll create a password. A couple tips: you'll need to be using either Chrome or Apple Safari or Microsoft Edge. Do not use Internet Explorer, which I don't think is even supported anymore, or Mozilla. And you don't need a lot of time. Once you get started, there are places you just pause and come back and add to more surveys. And we've tried to develop it in a way that you can do it at your convenience. And there is a mobile version of this. It's a little easier on the desktop, but the mobile version does work fine too. So if you find yourself in a line at a grocery store and you want to see if you can quickly answer a few surveys, you can do that. So as you come in, as I mentioned, you'll start with probably your own website. You'll come to a community page. You'll basically get a two-step verification to get your password established and register. And then you're off to the races. So then you fill out the patient consent form, data sharing, and then you start doing other surveys that will be coming. So for example, if you might start on your own homepage, and you can see in the top navigation, there is now a data collection program landing page itself that's here. Anyways, then there's the link to it too. We'll provide this presentation. This presentation is also being recorded too. So if you miss anything and want to go back and watch it, your organization will make it available to you. So this is your community page. So this is actually RareX created this for you. It really just explains data collection, why participate in data collection, and lower on the page is a whole, we want to be as transparent as possible. So there's a whole area of frequently asked questions that you can just click on the right-hand side and open those answers up for each of those questions. This is not from your page, obviously. It's an example from another group. And then also, there is ability to do some, well, I'll call it rough translations, basically a Google Translate so you can translate this page. The data collection program right now is only English, but getting into it, you can do some rough translations here. So then you'll basically get in for the initial login. What's very important here is you'll be identifying, well, a couple things. One, obviously, you're over 18. You acknowledge that this data collection program is coming from the United States. There's some boxes to check, but this is really important. Then you will start to, you'll categorize who you are. So are you the patient? Are you the caregiver? Or are you possibly a person who lost a loved one who had the rare disease? At that point, after you fill that initial part out, you'll get an email back. It'll give you a click in to start to create a password. If for some reason you don't feel like you've getting that email back, you might check your spam or junk folder file. So far, that hasn't been much of an issue. Usually it's getting through. And then you'll go through what's pretty typical now, two-step verification. So you'll provide your email address, you'll be sent a verification code, you'll put in that verification code, and then you'll create your password. At any time, you can see the RareX privacy policy or terms of use. And we try to, again, be very transparent with all that throughout. And even some of the very initial surveys, like consent survey, we'll see that we tried to write it in a very layman's language and use sort of a Q&A sort of style of making sure that consent is understandable. You will see another terms of use. This is for Matrix. Matrix is part of our technology stack that is providing RareX. So it's a little different entity, but basically you've got to accept their terms of use too. But again, we're overseeing the governance for this whole program. So you'll get into the consent survey. And as I mentioned, it's set up in a Q&A format. There's quick answers to the question, and then you can even click the box and even learn more if you need a more in-depth answer to the question. And again, our goal here, and really the reason why there's so much importance in the consent is, we want everyone to understand what they're consenting to. We also want everyone to understand that they're in control of their data. If for any reason at any time they want to say, I'm done with this, I don't want to be part of this, we can accommodate that too. On the informed consent, you'll really check all that applies. So it may be you with the you might be the patient, or you're probably going to be the caregiver in this case, that you're legally authorized to represent the patient if it's, say, a child. And then it gets into a little bit of things like, if there's this allows the whole program to work, where you say, contact me with follow-up research or surveys. So once you start adding your data, if you basically have to say, yes, I want to get more surveys down the line, or I want more surveys relevant to what I just did with the head-to-toe survey. And then also, too, you can decide if you want a qualified patient organization, which really is RareX in this case, to work and talk to somebody about a possible clinical trial. Just something of note, if you're the caregiver, you're going to provide your info first, and then later you're going to provide your child's info. So just make sure when you're filling this out, like this is very specific. So, it says, what's the child's complete given name? Just make sure there's not auto-populating happening on your computer to some of these open areas. And so you're also going to do this demographic survey. Again, it's asking everything from age to country you live in, to ethnicity. And we really are doing this for our own collection of data of people using the program itself. You're going to be doing this for both yourself as a caregiver and for the patient themselves too. Then a little further on, you'll get into, again, some general information, but then there will be a drop down for the disease itself. This again was just a screen grab from another one, but you'll actually see a drop down for HUWE1 that will be in the data collection program itself that you'll click on. In the data sharing survey, there's many options here. We strongly recommend you click on the first one and then you're done with that part of the data sharing survey. It's for general research. So this is the broadest type of research. This basically lets your data be seen by the widest number of researchers. So that might include a biomedical researcher or an educational institution that's doing health medical research. It could be other kinds of researchers, though. It could be a statistician or a citizen scientist, a great AI specialist who can really just take data and crunch numbers. And that, or it could even be a researcher looking at the demographic data to, consider, maybe policy changes that could help support rare diseases. We strongly recommend you click general research. You can narrow everything after that one narrows the number of researchers that can see it. So if you click number 2, only researchers in health, biomedical, research would see it. There's some other options, and again, these are optional. We don't recommend you click those because it just narrows things further. So you could say, I don't want any of my data to be seen by a commercial entity like pharmaceutical researcher. Or you could say, I only want research that's been approved by an IRB. RareX has its own IRB for this whole platform. So, but some of these things just start limiting how much your research is seen. And then continuing in the data sharing interest survey, we'll ask things, and some of these questions I'll call sort of future proofing. So right now we are not collecting bio samples, but it's something that we could be doing down the road. So we'll ask, do you know if biological samples were ever collected for the purposes of research for the patient? And then would you be interested? Say down the road, we do come up with a pretty non-invasive way, like collecting, saliva. That's just letting us know you're interested. If the capability comes along, we might come back to you and say, hey, you said you would be interested in collecting biological samples. Here are some options. So you always have the choice. This doesn't commit you to anything. It just, again, we're trying to make this platform stronger in the future. This is another area. Would you be interested in having medical records connected to your RareX data? So if you have electronic health records, over time, we're not doing it today, we might be able to link that to the data that's in here. Now, anytime we link that kind of data, it's also gets curated and de-identified too. So, and we do that coming up, and you'll see it about with a genetic report. And then we ask if you participate in other studies, and possibly if you have, would you be interested in sharing data from those studies with RareX? Again, if you said yes to this, and we go back and we talk to that researcher, we might say, yes, this many people said they would like to connect their data from your research to the RareX data. That may not be able to happen depending on the consent that was originally established for that research. And so we'll, if you have, or if you would be interested in sharing that data, we'll ask, well, what studies were you involved in? And of course, Dr. Barano, I believe I'm probably pronouncing it wrong, who was on earlier. Many of you were part of her study, and that was how the descriptor you would use in this section of it. But honestly, if you don't have to be super specific about the research. If you think you might have done something, but you're not sure, you can either not answer, or you can, kind of vaguely put it in. Like the examples in the green box are, what things that somebody might say, like, oh, Dr. Jones studied at the NIH, or I did something at Boston Children's. So, it's okay if you don't have the specifics. So this is, again, we're still in the data sharing survey. This is the early one, an early survey. We'll ask if you're willing to share your contact info. So this would be the only time that identified information would be shared. And this would be, we're getting your permission, if you want, to be shared with a patient advocacy group, like Louie's HUWE1. You know, again, yes or no. The only thing we would ever share in this case, if you said yes, was just the name and an email address. But no other data related to health data that you've put into the surveys. And let's see. Okay, so I kind of went through this. As I mentioned before, you're going to come in first as the caregiver. You can see in the upper left-hand corner, this Brittany Lane was the caregiver. Now, after they've gone through that and they've gone through their data sharing, they will then add the patient. So in that, oops, sorry. So the button on the left-hand side talks about adding patient, and kind of move my screen here a little bit. And then at any time too, you can always go back and click to open the dashboard, so you can always see where you are. So whether it's surveys that have been answered by the caregiver or on behalf of, or for the patient themselves, their dashboard, you can see those at any time. So you'd be adding a patient, in this case, if you're the caregiver, and just, you know, it'll give examples. So you might be the caregiver who's in, but you're viewing the dashboard, or you're viewing surveys for, in this case, the patient, Macy Lucas. So you can always kind of get a sense where your navigation is. As I mentioned, very first survey you'll do is health and development. And because this survey is the one that feeds all other surveys, or most other surveys. This view you see here is a dashboard. So in this case, if you upper left-hand corner, that's Sylvie Youngston is the patient. You see the tabs that say new in progress. These are all the surveys that have yet to be done for Sylvie. And again, the place to start is the health and development one. You'll also see some timing there. This is very generous or very conservative, I guess, depending on how you look at it. Most people say it takes about a third of the time that we estimate in here to complete the surveys. And then you'll also see the exact number of questions that are part of that survey too. So if you're in a, you have a little break and you feel like, hey, I could go do another survey, but I only have a few minutes, I can do, say, the race and ethnicity one. There's only 2 questions. It takes less than 5 minutes. And in truth, it probably takes 1 minute. So the head to toe survey is going to ask very broad questions. And again, they'll have a question like, have you had issues with eye, or the patient issues with eyes or vision? And then if there have been issues with sleep. Now, if you say yes, or if you say unsure, that'll trigger what's called a level 2 survey, which will do more in depth on that particular area of the body, or in the head to toe survey, and if you say no, you will not be fed a lot of surveys that have no value to you or you're the patient. I mentioned earlier about genetic testing, and in the health development survey, there's a question about have you done genetic testing? It asks a little bit about what was the reason for the genetic testing. It might have been actually to very specifically get a diagnosis. And then you would have the option, and we recommend this if you have it, if you have the genetic test report, you can actually upload it and connect it with the data that you're putting in. The way to do that is back to that same dashboard. There's a documents tab on the left-hand side. You'd click upload, you'd upload the genetic test report. And there are some other reports there right now that are labeled. I don't believe we're doing lab or audiology yet. Some groups might be, but I don't believe we're doing that on the general across the board yet. But the one that we are taking right now is genetic testing, and that's going to be important for something coming up later that I'll talk about. So after you've done that, that head-to-toe survey. Now you'll see what are called level 2 surveys. So if I answered yes to ears and hearing, or eyes and vision, or kidney and bladder, I would start getting those surveys, and I would see again that they're in progress or that they're being served up to me. I can basically, I still have the opportunity to answer those surveys. Once you complete a survey, it falls under that completed tab. So you can always see where you are. And again, at any time, you can go back to a survey, you can edit and change past surveys, you can add more information. If a symptom did not occur before and suddenly it's happening, or an area of the body is experiencing some new challenges, you can go back and add that in the head to toe. A level 2 survey then gets more specific. So if I had checked yes, there are eye vision issues, then it'll ask other things like, well, have is it eye movement issues? Is it visual impairment? Is it lens issues? And you'll answer either yes, no, or unsure. You will also be asked when that symptom maybe first started to show itself, and then if it was diagnosed, what age was it diagnosed? So that issue. It's okay if you don't know the exact age. And again, you can always leave it as unsure if you are unsure about, say, a timing or anything like that. At the bottom of level 2 surveys, there's always an open text box too, where you can describe any additional issues. So again, feel free to, if the questions above are unsatisfying or didn't really capture the symptom or what's going on, feel free to add to that. The only thing I'd recommend is please don't identify the patient. So say Johnny started to have issues with vision here. I would just, because we know it's the patient, we know who it is, that just would require more curation on our part to remove any identifying data there. As I mentioned, there's a completed tab, so you can check your progress along the way. And as I mentioned, anytime you can go back and look at the survey you filled out. You could actually print out or email that survey that you filled out if it's something you think might be helpful for your appointment with your clinician. You can edit it and as you go along. There are surveys. There's a whole quality of life survey. Now, there might be some things in the quality of life survey, like this question, my child has been physically able to do activities he or she most enjoys. There's an option usually to unable to answer, because in the case in some children, they may not be able to communicate, or they may not be able to communicate pain or certain things, and that's okay too, if that's the case. So just want to show you a little bit of some ways that we've already returned some data back to some other groups, and we would be doing this for you in the future. This was for a group. Actually, let me see. This is for a group that we took everybody who had answered questions for that community, and we provided this data back. So in this particular community, and I'm not exactly sure which disease this was, there were, obviously there were very high brain nervous system issues, behavioral growth issues, even eyes and vision, mouth and teeth. Less so with things like skin or even cancers. So, so this is the kind of data where we'll provide it back to the group, and the group might be able to provide it, back to the community, so you get a sense of where you might be and how you answer. Megan, did you want to add something?
Yes. Sorry, Tom, I threw these slides in and failed to let Tom know that I did this. I recently went to a conference for this disease, Wiedemann Steiner, and they had been very successful in getting their families to enroll very quickly. So we were able to show the families some data. If Tom goes to the next to slides, you'll see there that, families were able to see how their answers compared to other people. But also, although, yes, we are collecting this data for you so we can further research and find treatments, it's useful now. It's useful for IEP meetings. It's useful for a new pediatrician or a new neurologist. Sadly, none of your doctors will have 2 patients with this syndrome, more than likely, and they're going to ask you questions. Even your geneticist is going to look to you for the latest and the greatest. And so this will empower you to know more about your disease, to know what to look for. Your website has done a great job of telling you what this syndrome looks like, but it's young. And we only know about things that researchers have known to ask about in the past, but what if they didn't ask about, lungs? And it happens that, some kids develop lung issues. So I just wanted to motivate you that this is not for just for some research in the future. This is for you, and this is for now. And this is why it's so important that you all contribute as much data as often as you can. And again, sorry about that, Tom.
No, that's great. I appreciate that. And again, there was more examples that recently Megan took back to a group. They were having their conference, family conference, and we were able to give some of this information back. And there were some anecdotal stories like, gosh, if I had known this data, if I knew that my child would fall, or that many of the kids with this disease fell within the autism spectrum, I could have gone and got some testing for that. Or another case, there was some autoimmune issues. If they had seen that, wow, about half the kids have autoimmune issues, I might have been able to get prescribed IVIG or pick for things. So this is where data becomes really powerful for you as an individual patient. And we're trying to, so this past quarter is when we first made the data available to researchers. So that whole cloud backend where researchers can come and look at the data is now up and running. And if you're a proven researcher, you have access. We are also going to be launching in the first part of next year, Accelerate Rare, which is going to be an open science data challenge. Think of it almost like a data hackathon, but in this case, we're opening up to thousands of researchers. There's some really nice grant money available if they participate, and if it's seen that some of the conclusions they come to are of value, they can get some grant money. The FDA is going to be, letting us promote it out on their list, which is also reaching thousands of researchers. So, in essence, there's going to be a lot of eyes on this data coming in March. And so you want your data in here as soon as possible because we're opening the floodgates for researchers. There's 2 big deadlines. One is if you have a genetic test, to get it uploaded by January 15th. And then the other big deadline is to have as many level 2 surveys as you can possibly do done by February 28th, Rare Disease Day. And in March, we're going to be opening it up to researchers to start working the data. They'll work it for several months. And of course, we'll report back to your organization what were the results of the whole Open Science Data Challenge. So, and along the way, if you have questions or technical issues while you're logging in, adding data, you can always email us at support@rarex.org. And if you might even have questions that maybe Elizabeth can answer too, but start with us if it's specific questions, and that's really it. Again, this probably makes it seem more complicated than it really is. Some of the folks in your leadership team have already done it, and they've said it was pretty easy, pretty comfortable to do. So, but I'm going to open up for questions. If you have questions for Megan or myself.
I do want to mention, I think we have some caregivers here from outside the United States. So I'm sure the UK and German families are well aware of GDPR. And I just want to assure you, we have gone to great lengths and expenses and attorneys worldwide and as you know, GDPR is different in every country. So Germany's rules are different than Italy's and so forth. As Tom mentioned, we do have translations coming in 2023. Unfortunately, it will just be Spanish, French, and Portuguese to start. But anybody who can read English can enroll today. Tom keeps track of the number of people that have enrolled in RareX, and we have people from, I think, over 58 countries, and almost 40% of people enrolled in RareX are outside of the United States. So we know this has to be global. We know it has to be in many, many different translations, but translations aren't just done, from English to German. We have to consider all of the data regulations from the country where the language is spoken. And then we have to consider the cultural translations. Does this resonate in this country where this language is spoken? So we appreciate your patience. And if you have any questions about our technology, our privacy policy, or any of that, Tom showed you the community page with that beautiful photo of one of your children. Under the Get Started button, you can click on the terms of use and privacy policy. If you still have questions, we're here for anything that you need.
Any other questions today? And again, you can drop them in the chat if you'd like, or you can just raise your hand or go off mute and ask away. Nice to know I was so crystal clear on everything.
I may be repeating something Tom said, but you can do the surveys in any order after you do the health and development surveys. I urge you strongly to go straight to the level 2 surveys. Those are still simple. You won't need your medical records. And at the bottom of every level 2 survey, for instance, if it's about ears and hearing, and you're like, well, they didn't ask me about, excessive wax, then you really want to report that. You hit additional information and then you type it in, but just don't use anybody's name. The last survey that I would suggest that you do is called the diagnosis survey. It's all free text. So that's really for anything that you could not report anywhere else. If you do that first, you'll probably report too much, because really we're asking you a lot. There will be more surveys coming. Actually, there are 13 surveys related to neurodevelopment coming in the next 2 months. One of them is sleep, one of them is seizures. So when you answer yes to seizures right now in the brain survey, it just says, when did the symptoms start and when was the diagnosis? And you're like, but I want to say that it's tonic-clonic and it's 50 times a day. Hold tight, you'll get an email in a month or two that says, we're happy to report that we now have a seizure survey. And that survey will be more of a deep dive. When we get new surveys, if it's applicable to something that you've answered, we'll send it to you. If you don't update at least annually and change your no's to yeses when something changes, you may not find out about a survey that's applicable to you because you originally reported that it was not a symptom. As a parent of rare disease child who doesn't sleep and needs one-to-one all the time, I know your lives are so busy, but this is something that you can use. And this is something that is only as good as all the information that you all put in. So you'll hear people say, we need a natural history study. Well, to me, that sounds like something in a museum. What they mean is you need to understand what this syndrome looks like over time. And to do that, you need to see what is happening over time. So if you answer the survey today, great. We see a snapshot, a photograph. If you update it, you don't have to re-answer all the surveys. You just update it at least annually. We get a movie. We get the progression of disease over your child's lifetime. And that is really what is going to make the research move faster. So we recognize that these are questions that you may have answered somewhere else. We recognize that these questions are hard. I'm actually, Tom probably wasn't aware of this, but we have a new quality of life survey coming out. And it's going to be much more applicable to those of us who have children that are nonverbal. And so I would skip the one that we have now and wait until the new one comes out. It was designed by a researcher in Australia, and it is really aimed for those of us with children that are not able to communicate well.
Yeah, and Megan mentioned about the surveys upcoming. So yeah, about 13 new neurological ones are coming. I believe the goal, at the end of December, about 5 of those, which are going to be very relevant for the Open Science Data Challenge, will drop. So definitely, well, you'll get notified, I'm sure. If you get in there and start doing level 2s and do the head to toe, you'll get notified when it's available, and we'll be pushing hard to get those additional 5 surveys also filled out before the Open Science Data Challenge, because they'll add a lot more value to that whole exercise.
And we also will need genetic reports by January 15th, because we take those genetic reports that have your address and your name, and you upload it, and then our genetic counselors manually put that data into your account so that your symptoms are sitting next to your genetics. It's really important. Some researchers will not take a parent's word for the diagnosis. They want to see a genetic report. I know some of you may not have your reports, or you may have a summary, but you don't have the lab report. If you don't, contact Elizabeth, and she can reach out to us, and we can give you the steps of having to get that. You'll have to go to the doctor that ordered it, who will tell you the lab where it was done, and then you'll have to give them a release. But in syndromes like this, the genetics are crucial. So if you don't have it, I'll give that to you as a homework assignment.
Right. Yeah, go ahead.
Yeah, maybe just a practical question. Can I actually change the language while filling out the surveys? Because I sometimes struggle with, let's say, the medical language as such. And I guess that I kind of could switch between English and German, but sometimes it's just like the medical aspects itself where I might struggle. And sometimes I think it might actually even be easier in English for me to understand what they are asking. But sometimes, of course, it would be the German, my native language. So would that actually be possible?
We don't have a translation tool, but I know people from other countries have used a tool from the internet. I don't know which one. There might to do translation. So yes, and we do try and keep the language clear. But you're correct. There are some words that just don't resonate with families. I will also tell you, because I don't always read directions, so I did my caregiver. So it asks for your information first, not your child's. And it's really important that you keep this straight. So you put in your information, and then you consent about your information, and then you decide how you're going to share your data. Then you add a patient, and then you're consenting for your child's information, and then you decide how you're going to share their data. And because I thought I was smarter than the directions, I didn't read it. And I was like, what? It didn't save. Why do I have to do this twice? International regulations require that once we take any information about you, even though we're not taking your medical information, that you have to consent. So there will be 2 consents, one for you as a caregiver and one for your child. So, Elizabeth, was there anything that we didn't mention that you wanted us to address?
No, I mean, I just think when I was going through, because a lot of the board members have already done the data collection survey, and I think we all agreed that the biggest thing we noticed was you look at it when you first go in, you say, oh my goodness, it's 25 minutes for this, it's 25 minutes for that, it's 10 minutes for that. It really isn't that bad. I think I finished the whole thing in under an hour with all 4 of my children yelling at me at the same time. So it's gonna look like a lot when you first go in, but it actually does move fairly quickly through it. So don't look at it, get scared, and then leave the situation. Like, just stick with it, just finish it. Like, it actually goes a lot faster than it looks at first glance.
If you can't finish it, it will save where you left off, the last page that you finished. And you will get a reminder that says, thanks for starting the, growth survey, please come back and finish it. And we only send those, I think it's every 4 days or so. And you'll only get 3 reminders though, I believe. I think that we wanted to limit it. Yeah, I think my experience was the same thing. I had to check a lot of yeses in the head to toe survey. So I was like, oh, there's so many surveys, but really it went quickly. And these are things that you know. And again, this is information that will make you a better advocate in the doctor's office and the classroom. I've been in your shoes. It's interesting. Nobody believes the crazy mom, but when you bring a chart, suddenly it's all real. And when you have nonverbal children who can't tell you that they're constipated or can't tell you that they fell down and something hurts, this is the best voice that we can give you. I know some of us, I don't have mine on, but some of us wear these, awareness rubber bracelets. And I always say that creates awareness in the grocery line or at a cocktail party. But where you need awareness is in the doctor's office and in the drug companies, if you're looking for treatments. And if you're not looking for treatments, it's still nice to be able to be more informed. So I'm really excited for you guys. And I'm really appreciative for what you're doing. I know your researcher had to leave early, but researchers that are looking at neurodevelopmental disorders tend to look at more than one. And right now, Tom said we have over 41 diseases in Rare X. We're open to all 10,000 rare diseases. If your researcher went in today to the research portal and put a search on ear infections, autism, communication issues, and seizures, 37 of those diseases would have participants that would come into that she would see data on. So this is going to really allow researchers who have never heard of, HUWE1 to stumble across your data, which I think is magical because, that's the hard part about rare disease is people don't know about it. And gene therapy is specific to genes, but a lot of other treatments that are going to come down the road are specific to symptoms. So it may not matter what disease somebody has. It may matter what kind of seizures they have, or when the growth is stunted, or, you get the drift. So that's one of the things of having all the data from these different diseases gives these researchers a one-stop shopping. And they will be international. We'll continue to do translations. I'll go back on mute.
That's great. Great points, all of them. Okay, last chance. Any other questions you want to get in with us?
Hey, Tom, thanks for the review there. I think we missed just the very beginning, and I'm wondering if you could review, where do we go to start the sign up again?
Sure, happy to. Hold on. So you can either start at the website for HUWE1. There will be a link to what I'll call the front door, the community page that's on that site. So you can find this. The team here has all put them in the top navigation, data collection, because it's important. And then you will end up, or you can just take down this URL. This is your community page. This is the front door that gets into the whole data collection program. So it's HUWE1.rarex.org, and that gets you going. And then just that get started button gets you off to the races.
Got it. Thank you, Tom.
And I just put that in the chat. The last thing I will say is, once you've done this, please go on social media and say, it was so much easier. And at least this is the feeling I had when I was done. I said, today I felt like I did something for my child. And most days I feel like I can't. And encourage other families. I mean, you're here on a Saturday morning because this is something that resonated with you. The thought of research or the thought of doing something other than getting through the day is really overwhelming to a lot of your families. So they're going to need your encouragement. And I urge you to, social media is not always a positive thing, but this is a way you can use it.
Yes, and we'd all like to thank everybody so much for coming on so last minute and participating in this. We really appreciate it, and we hope to get some really good data that will help all of our kiddos. So thank you all so much.
Yes, and I'll be sticking around for about a half hour. If people want to go ahead and start the data collection, please go ahead, do it now. Just get it over with. Like, then go on with your day, It's really easy. Just go on to HUWE1.org, go to the data collection, like Tom just showed you, go ahead and get it started. I'm here for another half hour. You could probably get it done by then. And, we could be off to the races.
That's wonderful. That's great. All right. Well, with that, I think this will conclude the Rare X side of it, the presentation, and probably go ahead and turn off record if people are going to stick around. And